registered physiotherapist. Today I'd like to talk to you about a pretty common condition referred to as hip impingement. And also I want to just talk about one exercise that tends to be quite beneficial again for individuals who suffer from this condition. So essentially what hip impingement is well, first of all, you can think of the hip joint as a ball and socket joint. So it looks kind of like this. And so what ends up happening is due to different ways that the head of your femur, right, which would be this area here, let's say, and this region here in the hip, this is called your acetabulum from the pelvis. Essentially the way that head of the femur, how it's positioned within the acetabulum, there's some abnormal wear or irritation essentially as a result of this position. So for some individuals, the way that the actual head of the femur is positioned, it can be slightly forward, out to the side, etc. So there's all these different sort of positions, and then again, as a result of that, we get this wear and tear. I've seen some patients who have actually had, they're referred to as labral tears as a result of this hip impingement. And basically the labrum, it's just the outer surface essentially of the acetabulum, and it's really responsible for stabilizing the hip joint. Now, one sort of clinical test that will typically be positive with a hip impingement is called a hip quadrant test. And basically it's when we have a patient on their back and you put their hip into this flexed position and rotate, an inwards rotation, so to speak. And what that does typically is it closes down the space on the femur, and it can create this pain that clients complain about again when they have this hip impingement. And so, and one other thing that I tend to find a lot of times with these patients is they're super tight in their hip flexor muscle or their psoas muscle. And a lot of times the reason for this is essentially those muscles are going into essentially a protective spasm as a result of pain that's occurring because of this this joint abnormality, so to speak. So in a lot of cases, again, with this hip impingement, what I find really beneficial in terms of opening up the space and essentially biasing the opposite position to that hip quadrant position I was telling you about is to do a stretch for that psoas or that hip flexor muscle. And one of my favorite ones to do is actually on the table here. So essentially with patients, what I'll have them do is they'll lie on their back on the table here, and essentially the affected side here, we're going to just let gravity pull that hip open, so to speak, and again it's going to stretch out that hip flexor. And then what I'll have patients do is essentially just breathe in to that area and let gravity do all the work. And again, in a lot of cases with these patients, this particular muscle, it'll be working overtime all the time, and it'll be super tight, and this position here will feel great to go into. Okay, and then typically I'll have patients do that for a good 30 seconds, a couple sets of that, and what they find in a lot of cases is their other functional positions that were painful start to ease up. So prolonged sitting, for example, leaning forward, squats, etc. Again, please make sure that this is an appropriate exercise for your condition. And if you have any specific questions, comments, please feel free to leave a comment below, and have a great day.